Hello? Check. Okay. Good. What do you need? This is for what? Oh, it's okay. I don't need that. No, it's fine. So, all right, we're back. Sure, you can have a question. Yeah. So what I will, yeah, because he emailed the document, so maybe what we'll do, because we started late today, so we have a lot to do today, but maybe what I'll say is I'll say do these 5 cases for next Tuesday, and then when you come back we can talk about them a little bit. Yeah, because I mean at least today we might get short on time. And remember the end of it, so we basically go through a quick review. What is it, 6 weeks, right, I think? So we go through the quick review of all the major categories, so internal medicine, gynecology, dermatology, et cetera, looking at the major disease and reviewing the treatments and formulas for the patterns, major patterns. And then at the end, we do just cases. So the last day is basically the practice exam. We give a bunch of cases that are formatted just like the case study exam to give you more sense of practice, but I'll continue to integrate some in. The reality is it takes a long time to go through cases. You think that it's fast, but it would take us 1 hour to do one case in full, especially to check. So let's, I did give you a bunch of samples that if you haven't done, you can do, and if you have the textbook, what's it called, Practice of Chinese Medicine from Ma Chiu-Chia, you could actually go through and review the answers, okay? Yeah, you will. To check the answers? Well, that's what I'm saying is that the ones that you already have a bunch, because I sent the file that you have has maybe, that's, it shouldn't matter. Well, we got lots to do. Don't worry, okay? We got lots to do, okay? You'll have practice cases. What I'm suggesting is you go, the ones emailed you this week, you do, and we'll talk about a few of those each week. That's probably the best we can do within the context of this course, okay? So going into the actual notes, again, those of you that are online, the PowerPoint presentation is basically the same as what you have in your notes, so you should be able to follow along in the course books with these sections. So we're talking about NICA, or internal medicine, first, but of course we start with common cold and flu, which is really more of what we would call an external condition or exterior pattern, even though we're learning it in NICA. So the first page here is a summary of major signs and symptoms, major pattern types, and principal point selections. We'll just review it once and then we'll go through the details of each one and then to reinforce it. So major points for exterior cold and flu, we usually think of lung 7, Li Qi, Hegu, Li4, Dazui, Du 14, GV 14, and Feng Shi GB20. All of these are really designed to release the exterior. If we have wind cold, so this is again Taiyang, Shanghan, right? Taiyang Shanghan. We would add bladder 12. Why? Because one of the chief complaints is occipital headache, right? We taiyang headache. So because the patient has occipital headache with tightness and stiffness in the nape of the neck as a major symptom for wind cold, then we usually add this. And we can add Feishu because it helps open up the lung and induce, sweating to release the exterior, but also because we usually have some constriction of the lung. For formulas, we can use Jingfeng Baidu-san. We can also, oh, hello? You have no sound? Somebody online has no sound. Make sure your volume is turned up. Does anybody else online have no sound? I'm going to have to check with Alex. Tell me again if you have no sound. I'm not sure if it's just you or if it's everybody, because nobody else has said that they have no sound. So tell me again. It just pops up on my screen, and I've not used the system, and Alex has just stepped out to do some emailing. So tell me, message me again if you have no sound, whoever that is online. So for formulas, modified Jingfeng Baidu-san, what other major formulas could we use or would we commonly use for wind cold? Ma Huang Tang, Gui Zhi-tang. Okay, these are the empirical formulas, all right? Wind heat, we add Li11, lung 5. Okay, why lung 5? Because probably why this is the sun point. So we talk about the 5 shu points. And I'm, again, going through this now. We'll probably go through these in detail. But lung 5 is the sedation point for the lung. Wind heat is an excess condition of the lung. So we're trying to drain and clear the lung. Classical formula is usually Yin Chao San for wind heat. Yin Chao San. Patent medicines, Yin Chao Jie Du Pian. Something like this. And if we have cough with wind cold, so exterior wind cold transforming the interior heat with coughing, we usually use the Ma Xing Shi Gan Tang, right? This is the classical formula. So we don't necessarily need to modify the points for that. We'd probably treat it as a combination of all of the above for this condition. Why? How do I get it to go to the next slide? Oh, there we go. Okay. If there's dampness, if we have dampness, empirical points, spleen 9. So I would encourage you to think, I know that most of us in our training, we have additional or kind of special training. We may develop additional skills, but think about empirical or basic points, major points that are commonly used. So spleen 9 for dampness, summer heat, Wei Zhong, urinary bladder 40, and if there's deficiency, Zhu Sunli, stomach 36. These are all empirical points. If you see signs and symptoms related to qi deficiency, then you can add stomach 36 to support that. Some modified formulas, Xinjia Xiangru Yin, and Ma Huang Fuzi Xixin Tang. Now I should be cautious, of course, Fuzi, Xixin, these are a little bit hot. So, you just be mindful of that when you're prescribing. So wind cold or damage due to exterior wind, main signs and symptoms, nasal obstruction, cough, aversion to wind and cold. Okay, so dislike of wind and cold specifically, fever, general malaise, I would also add headaches and body aches. They may be present. It can, especially year-round, okay, we also usually consider this an upper respiratory tract infection, you know, colds and flu in Western medicine, and yeah, and maybe, you know, the epidemic cold, this kind of Shanghanlun perspective, slightly more severe manifestations of it. One of the main causes of common cold, we know frequent cold is related to deficiency of the Wei Qi, right? We frequent colds and flus is related to lung qi deficiency. We use, but systemically, it may also be related to a kidney deficiency. Frequent colds and flus mean we have a deficiency of the body. So a Zheng qi deficiency, kidney deficiency, lung deficiency, something like this. And that means that we can't fight off the xie qi, the evil qi. So it enters the surface of the body, also through our openings to the nose, eyes, mouth, right? We get the pathogen in. It basically obstructs the dispersing and descending function of the lung, okay, disrupts the dispersing and descending function of the lung, and then we have the, you know, blockage, you know, obstruction of lung qi, causes the nasal obstruction in the sinuses, and then also can cause cough and sweating pathologies, difficulty sweating. This is the dispersing and descending function of the lung normally. Okay. Meanwhile, wind heat scorches the lung and you know, generally causes these like more coughing and then the sore throat type symptoms. We also have more sweating and increased fever, right? Remember that the fever is normal for wind cold or wind heat, but we have more fever with wind heat. And then these generally, you know, heat or cold pathogens can mix with dampness or summer heat, okay? Cold damp, for example, or summer heat. Major patterns, major signs and symptoms in pathology. Okay. So again, chills, fever, headache, stiff neck, floating pulse, wind cold, more chills than fever, so more severe chills, slight fever, or possibly no fever, no sweating, so Taiyang Shanghan has no sweating. We say chicken skin or goosebumps, dry skin, okay? And Taiyang Zhongfeng, or wind damage, we do have sweating, don't we? So we need to be mindful of that. Those of you that are doing herbology, this is the TCMP. It's important. If you're just doing acupuncture, maybe not so important. But this is how we differentiate Ma Huang Tang from Gui Zhi Tang. Okay, so if it's all wind cold with no sweating, it's Ma Huang Tang. If it's all wind cold with sweating, then it's Gui Zhi Tang. Okay, good. Floating and tight pulse. Tight for cold. Wind heat, again, some chills, but more fever, more sweating, swollen, sore throat, increased thirst, red tongue, yellow coating, floating, and rapid pulse, major signs and symptoms. Summer heat, usually we have an unsurfaced fever, so we say a fever that does not improve with sweating, right? We sweat, but the fever comes back. We also have, you know, incomplete sweating, the same basic idea, and a feeling as if the head is wrapped in a wet towel. The heaviness of the body is major symptom, whether it's just the head or the entire body may feel heavy. The chest feels heavy, and decrease of appetite because the damp, summer heat, the damp component, where we talk about huoxiang zhengqi san, this kind of, yeah, so basically unobstructing the dampness decreases appetite, causes a feeling of fullness or bloating in the stomach area. And thirst without desire to drink. Okay, again, because we have heat which rises up, makes our mouth feel dry and hot, but then we have too much dampness. If we drink a lot of water, we kind of feel uncomfortable to our stomach. Greasy coating and soft or soggy pulse. Okay, main signs and symptoms for summer heat. Sorry guys, I'm just trying to figure out this the computer thing here because I'm not very versed in it. Okay, so why is this slow? Their computer is being very slow. Okay. There we go. All right, now I'm back. Okay, so additional treatment, so major points should have, okay, sorry, I skipped a little bit of, yeah, I was hitting next and it just wasn't going. So major points, again, lung 7, Li4, Du 14, Dazui, GB20, Feng Shi. Additional point, additional points are bladder 12, bladder 13, if there's cough, right? And wind cold, we can add those. For wind heat, we add Chu Chi, Li 11, Chi Zi, lung 5. Okay, lung 5. Again, lung 5, we can remember we use it for phlegm as well, and it's also a sedation point, the sun point, the child point on the lung meridian is was a water point because it's a 5-shu point. So water point on metal meridian means sedation. That's why we're using it here. If there's dampness, spleen 9, deficiency, stomach 36. If there's, now here we get to symptoms. So even though we're talking about cold and flu as a disease, we can also talk about nasal obstruction. And later, when we talk about the EFNT, the 5 sense organs, we talk about the nasal obstruction as a primary illness as well. So, wind cold is a cause of nasal obstruction. There's a little bit of overlap here in terms of several diseases may overlap, right? And here, Li20, or we can use the extra point Bitong, for this nasal obstruction. If there's, if headache is the main manifestation, so for example, patient comes in with severe headache, not cold and flu is not the chief complaint. The chief complaint is a headache, but the headache is acute, occurred after exposure to cold. The patient also has chills, fever, and body aches, and a floating tight pulse. Well, now we have wind cold causing headache, right? And we may add extra points to treat the headache directly. Here they're using Taiyang, or adding in Taiyang as an extra point. For painful, swollen, sore throat, we can use Shaoshang. Mostly we do the bleeding, right? So it's bloodletting for the painful sore throat. Okay, and in case of general malice or systemic deficiency, we can use Du 12. Okay. All right. Most of this is actually already explained. This is an explanation of some of the points in more depth. Lung 7, because it is, lung 7 Li4 is yuan low connecting point. Dodsway is the intersecting point of all the yang meridians. That's why we use it. I'm not going to go over this for every point, but I think it's important to understand why you're doing the points. If you just try to memorize them, you generally won't be very successful because it's too much to memorize all the points. You have to understand why the point is used, and then you can apply it appropriately. Feng Chi is, of course, releases exterior, but is also related to the Yang Wei Mai. So Yang linking vessel, Yang Wei Mai, and treats the head and exterior conditions. Additional considerations for treatment. So yes, we're mostly talking about acupuncture, but it's certainly within your scope of practice to perform cupping, bleeding, gua sha, these types of therapies. So consider if that is another appropriate treatment or an appropriate treatment for a given condition. Of course, all of these can release the exterior of the body and can be useful for colds and flus in TCM theory. So we can do cupping primarily on the upper shu points. So Dodsway, Shenju is Du 12, and UB 13 is the Fei Shu for the lung. Okay. Sorry. I'm not quite sure about, I keep getting like somebody kind of joins and leaves. I also unlocked it. Is that a bad thing? Should I lock the meeting?
Lock meeting so people can like join.
Access. Okay. Yeah. So others must ask to join. Yeah. I don't know who viewer 15 is.
You can just deny it.
But they're already in now.
You can kick them out.
But I don't know who they are.
But they didn't.
They didn't register. Okay. So we can allow her to join. Okay. Yeah, but who? I don't know who this is. Okay.
They have to input his like full name to join the.
Okay. Okay. So that I did not know.
I thought I would join the class over there and I'll write down your question.
Okay.
Chat session here and I will write it down.
Okay. Okay. So all right. So just going. Sorry, I kind of skipped a page here. So going back, we have cupping, and then we also should have bleeding as a acceptable treatment, additional treatment. So, for wind, heat especially, we may do bleeding. I already mentioned on lung 11, Shaoshang, okay? But we can also do bleeding and cupping on the upper part of the back, okay? So couple, just in terms of remarks, again, I'd like you to think a little bit about the treatment plan. So if it's cold and flu, remember, we don't need the patient to come for 12 treatments, right? Normally we can do a shorter course of treatment, but more frequent. Every day or every other day for, let's say 6 treatments, and then we can reassess or reevaluate, right? If we're giving herbs, normally what we do is just give a couple days, right? 2 or 3 days of a formula, and then have them come back, right, to reassess, because they change very quickly. Don't give 20 treatments or a month worth of Ma Huang Tong. That'd be a big no-no, right? The other considerations are like, of course, advice regarding stay out of the cold, protect yourself, dress warmly, don't sweat excessively, right? If somebody works in healthcare and or with children, wash your hands. This is not a TCM thing that we think of, but this is a modern health consideration. We might, if you see it, if you can acknowledge that that's an issue, then identify it. If, as we discussed earlier, if the patient has an underlying deficiency, you want to make, so lung qi deficiency or kidney deficiency, or other Jing Qi, Yuan Qi deficiency in the body, make sure that we have them then come back to tonify the body to prevent the colds and flu, right? Make sense? Dietary considerations. They may be, if they have wind cold, you may advise them to eat more Xinjiang, Songbai, things like this, spicy, hot foods. If they have wind heat, you may advise them against eating excessive seafoods and fried foods and chicken and things like that for at least a little bit. Maybe they drink more juhua cha, something like this, right? Sangjuyin, you know. Okay. So for wind heat, oops, I think I skipped on wind cold, major prescriptions. Again, Jingfang Baidusan, Jingjie Fangfeng Qianhu Xingren, Zhike, Chuanzhong, Guizhi, Gansao, Zisuye, Xinjiang. Okay, these are all kind of traditional formula, major formula to release wind cold. One thing that's specifically good about this is it does not use ma huang. Okay, we can use ma huang if it's really indicated, but this is one of those herbs that we always need to be cautious. Is there a heart condition? Is there high blood pressure? Something like this. It's nice to be able to use a safer formula. Obviously, use it if it's indicated. You can modify, so all these modifications, if there's no sweating, add ma huang. For severe headache, add bai jun qiang huo. Okay. For stuffy nose, sang erzi and xin yi. Okay. For low energy, right? For general discomfort, low energy, dang shen fu ling. Okay. Ge gen for stiffness and pain in the nape of the neck. For wind heat, yin chao san, empirical formula. Modification, if we have major headache, man jingzi, sang ye, okay, zhu hua, okay, for phlegm, bei mu, zhi bei mu, and gualo, okay, gualo shi, gualo pi, doesn't really matter, but gualo pi is here. For sore throat with swelling, xuan chen, tu nu shi. For severe fever and thirst, zhi mu tianhua fen. We may, if there's really severe thirst, we may even add elements of baihutang, right? So not just zhi mu, but we may add elements of like some shugao as well if we have high fever, high thirst, and sweating. So sometimes it can be wei and qi level heat. Where else? Toxic heat, da qingye banlangen. So something like strep throat, all right? Remember that strep throat patients should generally be referred to the doctor for antibiotics for strep throat because of the complications that can arise. But this is in TCM context. We usually consider that toxic heat, heat toxin, sore throat toxin, something like this. For patients attacked by dryness, dry throat, shashan, tianhua fen, li pi. I'm actually not familiar with that, li pi, and with I could check I'd have to check the Chinese characters for that one. For patients with dizziness, restlessness, cough, sputum, we can add yuju and baiwei. I mean, there's a lot of modifications here. Use what you identify. Most most of the time, if it's a simple case, the empirical formula should be enough. If there's, an additional severe symptom, then modify the formula as appropriate for the patient. Same thing goes with acupuncture. We have the major point combination. Then if there's painful, severe sore throat, you add bleeding to lung 11, Shaoshang, for example. It's a primary and then modification. Okay? If we have exterior cold, interior heat with coughing, Ma Xing Shi Gan Tang. Okay, this is a classical formula. Again, we have modifications that, if necessary, you can add them in. I don't know if I want to read through all of them because we'll never get through today. Sorry, 11:39. So are you doing TCMP as well, or just acupuncture? TCMP, right? Okay. Only acupuncture. Okay, so you don't even need to worry about the herbs, but some of the people do. Okay. You don't need to do herbs. If you're just acupuncture, RAC, not RTCMP, then no herbs. Yeah. So for every case, if it's acupuncture, you just do everything else but no herbs. If it's TCMP, you add the herbs. Okay. Okay. So summer heat, Xinjiang Xiangruyin. We're just going to finish this up and then we'll take a break. So Xinjiang Xiangruyin, Xiangru Jinyanhua, Bai Bian Do Hua, Bian Do Hua, Lian Chao, He Ye, Ho Po, Lu Gen, and Sheng Gan Sao. Okay. You can write this out, but you also may modify it based on your own practice a little bit, right? So, for example, I never really get Sheng Gan Sao. I just get Gansao. At least in Canada, is very rare. So I probably wouldn't add that because it's not realistic. Then we have cold and flu with a severe deficiency, basically Da Huang Fu Xi Xin Tang Ma Huang. And then we also have the Fu Zi and Xi Xin. So it's a very yang hot formula and releases Ma Huang, tonifies severe yang deficiency. It's a pretty strong and very strong formula that you should only use with caution. Okay, you should definitely know what you're doing with that formula. Okay, let's take a short break, and we'll come back in 10 minutes. It's 11:40, so take a short break, come back, we'll do another section. We start a little bit late, so I think that we'll push lunch a touch later. I think we're supposed to have lunch at 1 or something like that, so I'll just kind of go a little bit over, maybe 1:15 or 1:20, but if you need to, let's take a 10 to 15-minute break. If you need to grab a little snack now, go for it, and we'll see you in a few minutes. Okay. Check. Hello. Okay. Why you choose that point? So in the I would say you should explain it. You know, I would say that you should explain the function of the points and why you're doing it, as well as the why for the diagnosis. I mean, this is part of why it's only you're only doing a few cases, because you have to explain everything and you have to demonstrate that you understand the the methodology. Okay. So sorry, I have to repeat the question for the people online. The question is, if you're just doing the acupuncture, it would be basically the same questions. You just would not do the herbal part. The answer is that there's separate exams, so it's not necessarily the exact same case. Although basically the answer is yes, right? So it's not that it's the same. Basically, the answer is that you will do everything the same except for no herbs. Yeah. Mhm. 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 Sorry, what do you mean? Which way I think will be more benefit? Uh, mhm. 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 Yep. We will. I understand what you're saying. So we will do that, but let's also get through some of the basic information. I'm trying to. So for example, I don't even know if there are any cases that I gave that are cold and flu. It doesn't look like it, but mm, so sorry. Um, so we will do some more cases. All right. Let's go through a little bit more, and then we'll do some more cases. You know, for this. Okay. I think what's important here is that I want for you, what's useful about this section is to review what we consider the empirical points and empirical formulas. That's really the point. So when we talk about cold and flu, if there's anybody that does not know these empirical points that should be used, they need to know that. And they can't really learn it just by reading it, right? I mean, it should be, we need to make sure that everybody is on the same page. And then, you know, same thing with cough. If we say this is cough due to phlegm damp, right? When we go into the cases, when we do the practice cases, we need to make sure that everybody's has this information in on a basic level. Okay, so I'll try and go more quickly. I don't know how many pages this section is, but I'll try and go a little bit more quickly. Here, I have a printed version here that could help me a little bit. Page 30. Oh, 1-3. Oh, see, I'm so behind. Hey, we need to finish this today. Okay. It will take a lot of time. Okay. So then the other problem, and I'm just being very candid here for the people that are online, the other problem is that they cannot see what I write on the board. So visually, they can only see what's on the screen, which means that if I go off script, they can't see it in the screen. It's mostly the same as the book, but my point being, you're saying, oh, can you give me your perspective and things like this? I could do that and not do the PPT presentation, but then nobody can see it. So I'm just trying to keep that in mind as well. So Alex can't. No, we try because the system doesn't allow for that. So the system only has me this small, and then whatever we put on the computer, whatever you see on the screen is what the students online see. And then they just see, so yeah, this is what the students see. Same thing, right? So if I start writing on the board, they won't be able to see it. And so we'll have to take photos of it. Now that said, I can still verbally go through some of this. So, you know, when we talk about disease differentiation, so talking about cough, or we just talked about cold and flu, now we're talking about cough. The question is, what are the main patterns and what are the key signs and symptoms of those patterns, right? This is what the Handbook of Internal Medicine will focus on. This is what our notes focus on. It's the same thing that you are looking to identify. Patient comes in with cough, right? 8 principles. Is this internal or external, okay? If it's external contracted, okay, I think is this wind cold? This is our first pattern. What are the major points that we consider for exterior wind cold cough, okay? Well, we're still using these same principal points that we talked about with cold and flu. Lung 7, Li4, phase shu, okay, bladder 13. Adding lung 9 to increase function of lung, okay? For wind heat, the key signs and symptoms, all right? I may actually even just use this summary sheet a little bit. So the key signs and symptoms for wind cold are the same as we talked about, okay? Key signs and symptoms, Taiyang, Shanghan, okay? Wind heat, same signs and symptoms. What points do we add? Same points. This time, DO 14 is added for wind heat, Dazui, and again, Li 11 for wind heat, release exterior, wind heat. Empirical points for wind heat. Regardless, they're not actually treating the cough, are they? They're treating the exterior. And dryness, we can treat warm dryness. We can treat the same with the same acupuncture points as wind heat, Dazui, Li 11, and then cold dryness, we can add some. I'm actually not quite sure why they add liver 3 Tai Chong here. I probably wouldn't, but we could add Ren 4. Okay. For phlegm, so those are all the exterior patterns for cough. So again, I'm using this 8 principle differentiation. So we have exterior, and then I do heat or cold. Now I go interior. Okay. What are the major patterns? Phlegm damp. Okay. What are the empirical acupuncture points for phlegm dampness? Feng Lung, stomach 40, spleen 9. Okay. If it's phlegm heat, we can still use Feng Lung. Okay, it's not listed here, but we could use Feng Lung still. But most important is going to be lung 5, lung 7, and possibly Ren 17. CV17, Ren 17 is because of the cough, right? Wheezing. So Ding Chuan, right? Ding Chuan can be used for phlegm heat or phlegm dryness, wheezing and coughing, asthmatic type conditions. and coughing conditions with phlegm heat. For formulas, Chen Tong is empirical for phlegm damp, and actually sometimes we can use, if there's exterior cold and interior phlegm heat, Ma Xing Shu Gan Tong, can't we? Right? Or Qingjin Huatan Tong. For liver fire attacking the lung, this is the two major organ involvement. The cough is the secondary, even though it's the disease, it is caused by another organ pattern. So it's a secondary pattern, looking for other signs of liver fire, right? The empirical formula becomes Xie Bai San, or plus Daige San, or we could even use a modified Longdan Xiegan Tang, which is for the liver fire. We still use the same points for coughing, but we add liver 2 here. Liver 2, empirical point for liver fire, liver heat. If there's lung deficiency, what are we looking for? Key signs and symptoms, right? Key signs and symptoms: frequent colds and flus, spontaneous sweating, low energy, weakness, weak cough, right? Non-productive. So then we need to tonify the qi systemically. Ren 17 we can add, but I would also add Zhu San Li, stomach 36, right? It's a qi deficiency. We probably want to add that. We can use Bufei Tang or a modified Yu Feng San. Yu Ping Feng San, however, doesn't really treat coughing, right? So you have to address the coughing. Lung yin deficiency. Lung yin deficiency would be possibly related to tuberculosis or some other condition like this. Night sweating, key signs and symptoms: night sweating, red tongue without coating, thin rapid pulse, okay, and cough that may be aggravated or worse at night. May also be like dryness of the throat, thirst with desire to drink in cold small sips. You could add bladder 43, Gao Huang. You can use a modified Shashen Mai Dong Tang formula. The these are the major patterns and major signs and symptoms related to cough. Major points, major formulas, major signs and symptoms. So as requested by the students that are here in class, we want to spend a little bit less time reviewing this. So I'm just saying to all of those of you who are online, again, the assumption is that you have some of this basic understanding already, and this is kind of review. So go very quickly through this section, move into the next disease. I won't go through all of the key details, but I'm going to, especially with the point selection and the formulas, I won't go through them again. We'll just do the summary for those. But let's talk a little bit about the coughing here. Key signs and symptoms, you mean? Like, what are the key signs and symptoms for each disease? Okay. Okay. So just a request to focus a little bit more on the key signs and symptoms related to the pattern. So exterior invasion, right? Key signs and symptoms that pathogen is external in nature. chills, fever, headache, body ache, floating pulse, aversion to wind and cold, okay? Those are the key signs and symptoms that it's exterior. If you want to separate wind cold from wind heat, okay, then we're talking about separating tight pulse, no sweating, more chills, compared to rapid floating tight pulse, rapid floating pulse, floating and fast, more fever, sweating. Okay. Hang on a second. Okay, I just gotta take a short 30-second pause. So, okay, so for exterior patterns, that's what we're looking for. And we know that the mechanism is the same as what we just talked about with colds and flus. We just have inclusion of coughing as a main symptom. Okay, for internal conditions, main signs and symptoms. We're often, so there's a couple larger groups here, but first we'll talk about phlegm. Key signs and symptoms of phlegm damp is going to be white or clear sputum, phlegm, ton, that is easy to cough up. It comes up easily. The tongue is swollen, pale, thick white coating. The pulse is slippery, right? You know, there's poor appetite, epigastric distension, all of these signs and symptoms associated with phlegm dampness, okay? But the nature of the cough itself is easy to cough up, and with the white and phlegm. Phlegm heat, in contrast, is yellow or green, sticky, difficult to cough up. Okay, there may be thirst with it. The pulse is slippery and rapid. The tongue is reddish, or could be red, slightly swollen with a yellow coating, yellow greasy coating. Okay, the main differentiations here between phlegm damp and phlegm heat. Heat type, cold type. So the couple other patterns, so the other excess pattern we talked about was liver fire attacking lung. Of course, this is the Shenke cycle, so the 5-element controlling cycle. You know, we have I'm just drawing, for those of you online, I'm just drawing the 5-element cycle. We have, this is wood, right, fire and earth and metal. Okay, so this is what we call rebelling against the grandparents, so the wood rebelling against the grandparent, which is metal here, so the liver rebelling against the lung. We usually just call it liver fire attacking the lung or something of that nature in terms of a diagnosis. Let's get let's wipe off. Okay. And, you know, key signs and symptoms then essentially are going to be a cough that is aggravated with stress or anger or emotional upset. That the cough is likely, you know, hacking in nature, and then a key symptom is often blood streak sputum in the cough. All right, this is not the only. It's not the only thing that, you know, wind heat could cause blood streak sputum. Also, yin deficiency can cause blood streak sputum, but often liver fire will have that. And then, you know, we should have other signs and symptoms such as a red tongue, yellow drier coating, a wiry and rapid pulse. So I think wiry is the Schwanmai, is that right? Schwanmai. Wiry, rapid pulse, thirst, red eye, maybe some other internal wind symptoms such as headache or tinnitus or something like that may be present as well. Okay, so far so good. And then lung yin deficiency, I think I already mentioned. Key signs and symptoms of lung yin deficiency are going to be a dry cough without phlegm, right? So usually a dry cough without phlegm, a little bit weaker, red tongue, peeled coating, thin or thready rapid pulse, right? Thin or thready rapid pulse, and thirst, you know, difficulty sleeping, maybe night sweats, hot flashes. We say the 5 centers heat, the palms, soles of the feet, okay? Key lung yin deficiency. All right, so then the treatment here, I'm just going to kind of breeze over. I'll leave you again to review this on your own. I already went through the main points. A lot of these are repeated, and you know, you can, you know, I guess one thing that maybe is I'm just seeing what points we didn't talk about. So I just saw lung 6 here. This is the Shi cleft point. So remember, the Shi points on yin meridians are useful for bleeding. So if we have coughing with bleeding, right, even if no matter what it is, then usually I would choose this point as to another lung point. So the yin organ with bleeding symptoms of that organ, we usually choose the Shi cleft point. So that one we didn't really talk about. All the other ones we mentioned, stomach 40 for phlegm, liver 2 if it's liver heat, Ren 17 for descending, lung 9 if there's deficiency, spleen 6 if there's deficiency, etc., etc. Okay. Topical herbs is an option. You know, this is certainly a form of treatment. This is a topical herbal treatment. We may use it here for exterior patterns. So I'm also going to briefly talk about the lifestyle and course of treatment options. So if it's if it's an exterior pathogen, we probably want the patient to come more frequently, every day, every other day, for treatment for a shorter period of time before we reassess. If it's something like liver fire attacking the lungs, or it's a more of a chronic yin deficiency, we may want them to come like 1 to 2 times per week for a course of 8 treatments and then reassess, or for a course of 1 month and reassess, or something of that nature. Same thing with herbs. You know, if it's an exterior pathogen, we don't want to give, you know, usually we start with 3 days of herbs just to see how they respond, and then we change the formula because their symptoms may change. But if it's a yin deficiency or some other chronic condition, we might give them a little bit longer before we reassess. The lifestyle considerations for liver fire, we should advise the patient to do Tai Chi Chuan, Qigong, something like this, to calm the emotions of the liver fire, right? Because it's usually related to anger and stress. So we may want to include that as part of their treatment regimen. Dietary considerations are always present. If somebody has phlegm dampness, we may need to look at tonifying the spleen. So if it's cough due to phlegm damp, we may add some spleen points such as spleen 9, spleen 3, spleen 6 maybe, spleen 3 in Fenglong, though stomach 40 and spleen 3 is a yuan lo connecting combination. But we'd also want to talk about diet. Don't eat excessive dairy, don't eat cold foods, raw foods, nourish the spleen qi, eat warm foods, cook foods, more ginger, etc., etc. Okay? So, any questions on that? Online, any questions? Okay. What's the name of the point is, sorry, I have to go back and find the name of the point is Gongsui. Yeah, lung 6. Gongsui. Yeah, because it's the cleft point, right? The Shi point. Yeah. So for bleeding, you know, for menstrual bleeding, we may use the Shi point of the spleen or liver. For, you know, coughing of blood, we use the Gongsui. Gongsui. Okay. My tones are not very good. Okay. Prescriptions I already mentioned. So again, those of you that are studying herbs, I'll leave it to you to go through them and review the formulas in more detail. Because you have the reference textbooks, it shouldn't be that big of a deal. It's mostly, I guess you're right, it's mostly about being able to identify what is the right diagnosis. That's more important because you can then look up the formula, right? Okay, so where are we? So wheezing, asthma, and breathlessness. You know, all of these are really, so these are the three major, I think this is the last one for the lung condition. Is there a table of contents here? Yeah, respiratory disorders. So this is the last kind of main disease that we talk about. It's not that much different, right? All the lung patterns are really similar. It's got to be one of these lung patterns, or it could be, in the example of the liver fire, attacking the lung, it could be related to another organ pattern. So mostly the wheezing and asthma, we're just talking, you know, there may not be a cough, but it's an asthmatic condition. Similar pathologies as cough. So it's the same patterns, really. Look, wind cold, wind heat, phlegm heat, okay? Slight difference, you know, we almost, in the empirical points and herbs that we use, because we're treating something different. So our goal now is to stop the wheezing rather than stop the coughing. Some points may do both, but for example, Ding Chuan is empirical now. So this is the slight difference in point prescription or formulas. You know, we don't need to use the stop coughing herbs as much. We will use small amounts of ma huang more because that's useful for the wheezing in certain conditions, but for the wheezing conditions. So, you know, the formulas change a little bit because the formulas that treat, you know, Ding Chuan Tong, for example, the formulas that treat asthma are a little bit different than the formulas that treat coughing. So principal patterns, I almost feel like we don't need to go through this in that much detail, right? Because we really already went through these patterns. Wind cold, wind heat, same signs and symptoms. You know, the key point for both of these is that it's acute asthma, right? It's not chronic asthma that they've had for years and years and years. If it's wind heat, wind cold, it's acute shortness of breath. You know, it was summer, they were working outside, and then since then they had some wheezing and difficulty breathing, right? This is still the same category of disease in the TCM context. Phlegm heat or phlegm damp could cause asthma. It's more common. You see that we don't have phlegm damp here, do we? No. Don't have phlegm damp because it's not as common as phlegm heat. Phlegm heat is the more common pattern related to asthma, and you'll see this more and more. If I was teaching internal medicine, so when we actually teach this course, you look in the big textbook, we do see all options. There's probably about 10 other patterns that are possible, right? But we want to focus on the more common ones to make it more narrow because we don't have time. Right? You know, we don't have 120 hours. We only have 8 hours to do this, right? So phlegm heat is more common a cause of asthma specifically. If a patient has phlegm dampness, they probably have cough as well, right? It's rare to have the phlegm damp with asthma without cough. We see the one new acupuncture point that we're using here is Ren 22. So this is, you know, descends the lung qi, you know, this strong point. We also can use it for coughing, but is a little bit dangerous if the patient coughs when the needle's in. You just got to be a little careful there. Other major patterns, lung qi deficiency, and kidney qi deficiency. So the common, you know, of course, lung weakness could cause shortness of breath. Yu Ping Feng San, again, is the kind of basic formula. Here, because we don't have coughing, it may be okay, but we probably still want to modify it a little bit to address the signs and symptoms because, you know, Yu Ping Feng San doesn't, it mostly just tonifies the qi of the body systemically via the spleen, right? It doesn't really address shortness of breath by itself. Kidney qi deficiency is the other major cause because the kidneys, quote unquote, grasp the lung qi. They pull the lung qi down. So if we have shortness of breath that is difficult on inhalation or gasping, asthma attack, that is, so there's two different, if you bear with my sounds for a second, we have either right? Whereas I'm having difficulty inhaling, and that's versus the difficulty on exhalation. Do you see? You can, so, you know, in text, you know, when we actually write the case in paper, we may say patient has asthma with difficulty inhaling versus asthma with difficulty exhaling. If we see that difficulty on inhalation is a key sign and symptom that's related to the kidneys. Of course, we would likely also have a weak pulse in the true position, weak kidney pulse, some other kidney deficient symptoms such as, you know, urinary incontinence, or maybe it's an older patient, or it's somebody who has had asthma since childhood, so congenital yuan qi, kind of prenatal condition, right? So poor constitution may also be related to kidney. So we can look at those. And then points that we add, kidney 10, Yingu, and Guanyuan Ren 4. We could also add UB23 if we wanted to. Excuse me. Or even kidney 3, kidney 7 could be added sometimes, but probably not too much. Just 1 or 2 points for the kidneys to help pull the qi down and strengthen the kidney function. Okay. Review of some of the Western medical conditions, because this is something some people struggle with, would be bronchial asthma, chronic asthmatic bronchitis, pneumonia, emphysema, cardiac asthma. So that's shortness of breath with, you know, angina or something like this. But we should be able to identify key differences for some of these conditions. Specifically, I'm thinking cardiac asthma, we should be able to acknowledge the importance of the heart condition if present. All right, so the understanding of the pathogenesis is really, I mean, I think that what happens is we learn this, so the etiology and pathogenesis we learn when we're in school, you know, or our teacher explains it to us when they're treating patients. We learn this, but then we often forget about it a little bit. And in the case study exam, knowing the pathogenesis is very, very helpful to understanding the diagnosis and treatment principle. So all three of these really go together. So even if it seems like it's very basic knowledge, you know, oh, I understand what's happening with phlegm in the lungs. Well, the fact that you know, the relationship, for example, with the kidney pattern, you can't just memorize the signs and symptoms and treatment. You need to be able to identify that the kidney is not grasping the lung qi, and that's why we're strengthening the kidney function with that pattern. So again, I don't know if I need to read through this all, the pathogenesis of the disease, but you really should know this for all of these conditions or all these patterns, is understanding how the phlegm damp causes cough or how it causes shortness of breath. Mostly with the lung, it's simpler. With other organs, it's a little bit more complicated sometimes. All right, so a few other the key symptoms, the qi symptoms here for the excess patterns specifically, which are the wind, cold, wind, heat. It's going to be harsher, deeper, prolonged, preference for exhaling. So this is actually the talking about the aggravation on exhaling, forceful or excessive pulse, and also shorter episodes and more acute in nature, not the chronic I already mentioned. Whereas when we look at, so again, just going back, this is a repeat signs and symptoms of cough from wind cold. Wind cold is going to have aversion to cold, you know, watery or you know, white phlegm, if any, headache, no thirst, right? No sweating. This is the same, repeating the key signs and symptoms of wind cold. Any TCM textbook will list wind cold, what are the signs and symptoms, and shortness of breath is one symptom. Coughing is also one symptom. We're just, you know, with disease recognition, we're flipping it the other way around. We're saying coughing, right, is, these are the possible causes of it, okay? So, you know, again, phlegm heat or wind heat will have the same, you know, fever, headache, floating, rapid pulse, thirst with desire for cool drinks, you know, yellow, red tongue body, some yellow coating, et cetera, et cetera. All right, so repeating those major patterns. You know, the only one, again, that is new in terms of signs and symptoms is the kidney qi deficiency pattern here, which has a few additional symptoms such as a cold after perspiration, pale tongue, thin white coating, deep thready pulse, deep pulse because there's not enough yang qi, et cetera, et cetera. Okay? Primary treatment we already discussed. There's nothing new here, no new points even. The points are basically the same. Ren 22 and Ding Chuan are probably the only ones that are new. All right. Kidney deficiency we already talked about. Bladder 23, kidney 3, lung 9 is a yuan source point, so it's more tonifying. Kidney 3, yuan source point, tonifies the kidney. Stomach 36 nourishes the qi of the whole body. You know, Ding Chuan empirical for asthma. Alternate methods of treatment, topical herbs, plasters, again. It's discussing the point injection treatment, so the injecting of the cat gut into the points. We have to be extra careful, especially at phase shu, because injecting, you have to be very, very careful, because that embedded needle is going below the hollow tip needle. So this is the upper back shu points. You have to know very well what you're doing if you're doing the point injection therapy at those. But it does allow for the chronic treatment, because that way they don't have to come frequently. Alex is trying to come in. No, it's not locked. It's not locked. It's not locked. There. It's just sticky because of the paint is fresh. Yeah. Okay. So just finishing up here with the asthma lifestyle condition. So actually, back to this idea of the embedded needle therapy is simply, it is a way of treating that that would prevent the need for the patient to come as frequently, because it says every 15 days. So actually, this is a good method for chronic asthma. However, in Ontario, I do not recommend writing this down for treatment, because it's, because you're essentially going outside of our scope of practice. Let's say you're in a gray area. So I don't, even though it's in our book, I don't recommend discussing injecting, needle injection, point injection with the herbs, or point saline solution, or point injection with the catgut threads. Okay. Even though it's in these notes, I don't recommend including this in your exam. So in terms of treatment, if it's acute, more frequent. If it's chronic, a little bit spread out, longer course of treatment. And specifically, we talk about the dog days of summer for preventative conditions and asthma. And then we should have a little red flag here. As I mentioned, cardiac asthma is often seen in the left heart insufficiency due to pneumoedema, and should be properly diagnosed. In this case, acupuncture may be used as an adjunctive therapy. It means that you need to refer this patient to a medical doctor if they haven't already seen one, right? So if you see the cardiac asthma or heart symptoms with shortness of breath, difficulty breathing, and a bunch of heart symptoms, refer generally, okay? And you should be able to identify a cardiac infraction, right? A heart attack compared to angina pectoris. Lifestyle conditions, dietary conditions, allergens, smoking, okay. All of these, may be worth considering depending on the pattern. If the patient eats a lot, if they have phlegm, be mindful of diet and things that they may be eating that could be adding to or aggravating phlegm and dampness. And then consider removing the herbs that agitate the lungs, such as I mentioned before, there's seafoods and bird, duck and chicken type foods, okay? Major formulas, phlegm, cold phlegm attacking the lung, Shigan Malpong Tong, okay? Phlegm heat, Ding Chuan Tang, modified. Blockage of phlegm, so this is basically phlegm damp. Use Chen Tang, but if it's phlegm heat, then Sang Zi Yang Qin Tang should be added. So, you know, Chen Tang is pretty warm in nature by itself. For liver qi stagnation, Chai Hu Shugan San is more commonly used for the coughing because it has an effect on the liver's relationship with the diaphragm. If there was a lot of fire, heat, we may want to add some of Longdan Shigan Tang to that formula or modify it in some way. And for lung deficiency, Yu Ping Feng San, and you see that they're adding, what are they adding? Dangshen, Weizi, Huator, and Shanyao to have a little bit more of an effect on the breathing itself. For spleen deficiency, Liu Junzi, Su Junzi, some modification of those formulas based on what's appropriate. Kidney deficiency, Jing Gui Shen Qi Wan modified is appropriate. Okay, it's more of a yang deficiency or qi deficiency. Okay, any questions so far? It's 12:42. Wow. How's everybody doing online specifically? And are you guys okay with this pace? Is this okay? All right. So I'm just checking. I'm trying to assess how much time we have and how much time we can spend. So we're still really quite a bit behind, aren't we? All right. The important thing is that I think that as we do go through this seminar and each section, as we're going through each section, it will become faster. I like to take the beginning a little bit slower to make sure everybody is up to speed, and then you can apply the principles later. These principles to pattern differentiation and point selection and things like that we can apply later a little bit more easily. Is everybody okay? I mean, like it is, I said that we would go a little bit later. Are we okay to go for another 30, like, can we do one more section, maybe 30 minutes or, yeah? Okay, because we started late, so I'm just trying to get caught up. Give me 1 second to just have a little drink and wet my throat. A lot of talking. People online have questions or sent in? Okay. All right. Okay, so the next section, the next group is actually like digestive, spleen, stomach conditions. You know, again, of course, there are more diseases that could be related to the lung. So terminology is more important. So, for example, hemoptysis, right? So, like, we need to know the bleeding conditions, bloody nose or coughing of blood. We need to know those terms. Again, have a dictionary. Remember, you can't bring anything digital in there. So if you don't have a printed dictionary, right, make sure that it has some of these basic medical terms in it. Just, you know, most of the lung conditions will be these similar patterns or pretty close to it in similar formulas and treatment principles, even if it's a different disease, okay? Spleen, stomach conditions, vomiting. So major causes of vomiting is rebellious stomach chi, so there's more causes. So vomiting can happen with pretty much any disruption of the stomach's descending function, right, that can induce vomiting. So we have, again, we can think 8 principles. Are there exterior patterns that cause vomiting? Yes. What are they? Well, the most common exterior pattern is summer heat, yeah, you know, basically damp heat, summer heat, attacking the middle jiao, right? So summer heat attacking the middle jiao causes vomiting, nausea, diarrhea, this kind of stomach flu, basically. Okay. We can also have what are, so this is the most common exterior. We could have, you'll see some, so for example, in Tai, in Shanghanlun, we talk about Tai Yin stage, that there's some nausea and can be vomiting and that, and that's really but that even is, we say Shanghanlun is from an pathogen, really Tai Yin stage is Li Zhongwan. It really manifests more as a spleen and stomach deficiency, right? It's like Qi Yang deficiency. So we don't need to really consider that separate from a deficient pattern. In the context of 8 principles, this is really it's not external anymore. It's internal deficiency, right? So 8 principles again. We have, so as I mentioned, exterior. Most of the other conditions are going to be considered interior patterns. Interior patterns, we have excess and deficient type. Excess has a bunch of them, right? So excess, we can have cold damp. So maybe you eat something like ice cream and it makes you sick, or you have some other internal cold condition that's excessive in nature. We also have internal heat. So this would, this could be, for example, damp heat in the middle jiao that would aggravate the stomach and spleen. We have nausea and vomiting possibly. Phlegm accumulation, phlegm damp. Now this happens primarily because we have, we know that all phlegm is related to the weakness of spleen, but we cough up, so somebody especially that's elderly and has severe phlegm damp accumulation, they, one of the signs and symptoms of phlegm damp is nausea and vomiting. Now, this most often happens when somebody is coughing profuse phlegm and sputum and swallows it, right? Because they don't actually expectorate it. So the phlegm goes from the lung and then we swallow it down. It builds up in the stomach, causes digestive disruption, and can cause nausea, vomiting, poor appetite. We also have the other excess pattern is the liver attacking the spleen and stomach. We see nausea and vomiting related to, even like if we want to talk about 6 stages, we could say the Shaoyang stage has some nausea as a symptom. We also have, so like in, in Chai Hu Shugan San formula, we use it to treat nausea and discomfort related to excess of the liver, which then, according to the 5 elements, we have liver overacting on spleen and stomach, or liver attacking the spleen and stomach. Usually we use Xiao Chai Hu Tang because it has Ban Xia, so that helps with the nausea, Ban Xia Shengjiang, okay, redirecting that rebellious stomach qi. And then we have deficiency of the spleen and stomach. So again, 8 principles thinking, going through that process. Oh, patient has nausea and vomiting. What's causing it? Is it a cold? Is it a viral bacterial infection, cold and flu, i.e. summer heat, summer damp, right? No, it's not, okay? All right, well, then it's internal. Well, is it an excess condition or deficiency condition? Do I see weak pulse, pale tongue, low energy, poor digestion, undigested food in the stools, loose stools, soft stools? Well, that's more deficient type. Do I see pain, worse with eating, acute onset, right? Aggravated after food. So there's a few other patterns that aren't here that we probably should consider, unless there's more on the next page. Yeah, okay, so sorry, there's a whole other page of patterns, which is food stagnation, food retention, right? Eating something that's bad, eating something when you're emotionally upset. Okay. I'm wondering actually if we should, signs and symptoms. Do you want to talk more about signs and symptoms of these? So specifically, let me just, Okay. Food retention, abdominal distension, acid regurgitation, dry vomiting. So I'm just going back and let's focus a little bit on signs and symptoms and then endpoints, okay? Because we're doing this in a slightly condensed format. So those of you who are at home, I would encourage you to follow along with what I'm saying in the notebook, because I know what you see on here is that I'm just using the summary sheet right now on the presentation. They see that, but I'm encouraging that you guys actually look under the descriptions that come later in this section. So key signs and symptoms, vomiting due to cold obstruction probably is related, the onset is related to eating something cold. The vomiting would be aggravated by that cold. The nausea and vomiting would probably be improved with warmth. It usually has pain because excess cold usually has stomach pain as a symptom because cold causes contraction and constriction, right? So we have, along with the stomach pain, we also have the feeling of cold. So cold hand, for example, cold hands and feet, feeling cold, chills, paler complexion. The tongue is probably pale with white coating. It may be slightly bluish because of the stagnation that's starting to arise from that. And the vomiting is probably going to be more clear fluids, vomiting of clear fluids or something of this nature. In terms of points, we should certainly most importantly think about doing moxibustion or heat therapy to REN 12, stomach 36. They're using REN 13 and UB 21. So these are all okay. You can use REN 12. UB 21 is actually the Mu Shu, front Mu, back Shu combination, is good for the excess condition, right? Opens up the stomach, helps redirect the qi. And then stomach 36, this is almost always empirical, and Niguan also for empirical for nausea and vomiting. Why? Because Niguan pericardium 6 is the master point for the, or helps to open the yin wei mai and activate through its paired function with the chong mai. So for heat pattern, signs, and symptoms, okay, we're looking more for, of course, the tongue and the pulse, the red tongue maybe with the yellow coating, and there is basically everything that I said before of feeling cold. The patient probably feels hot, feels discomfort, has thirst, preference for cool drinks. The vomit may be a little bit stronger, more like acidic or foul-smelling vomiting. Okay, so they may have other interior heat, such as some mild constipation, yellow urination, things like this. Okay, pulse is probably rapid and full. If there's phlegm, so phlegm accumulation, remember there's two types, but normally it'll be more phlegm damp than phlegm heat, because phlegm damp we have a greater quantity of phlegm. So they'll probably also have chest depression, bloating and distension, coughing up or expectoration of profuse, white, clear phlegm. The pulse is slippery, the tongue is swollen with a white, greasy coating. All right, this is the nature of phlegm damp. And the vomiting, maybe like they'll feel better after vomiting, right? That may actually improve because they're getting some of that phlegm out. So their stomach discomfort might be improved after vomiting. Adding stomach 40, Fenglong, and REN 17. We may also add, we're already using REN 12 already using stomach 36 Dusonli. So it's a pretty good treatment right there. We might want to add spleen 3 or spleen 4 if there's any other digestive weakness, because we know that phlegm is produced by the spleen. So you might want to strengthen that a little bit. Chen Tong is usually enough to treat it. If we have key signs and symptoms, vomiting with liver qi stagnation, again, I'll put two. So one would be vomiting and nausea related to emotional upset. Two, this is a common pattern of menstrual cramps with vomiting. So specifically when, if we feel vomiting or nauseous with severe menstrual cramps, we usually associate the severe menstrual cramps with the liver stagnation, liver qi and blood stagnation, and we're going to treat the liver along with the menstrual cramps. So, you can add, usually liver 3 is kind of an empirical point, but you might want to add 1 or 2 other points. So specifically, I'm thinking we're already using Niguan pericardium 6. I would probably add spleen 4 if there is severe menstrual cramps with nausea and vomiting, because this is the master and couple point of the Chongmai. Okay, so it's indicated for that condition. Gallbladder 34 is a useful, more for the liver, the real liver, hypochondriac pain, bitter taste in the mouth, this kind of condition. So for example, again, before I use the example of Xiaoyang syndrome, right? Xiaoyang syndrome, we do have nausea and vomiting. We can have this. So then we would use gallbladder 34 here, Yang Ling Chuan. Deficiency usually it's more like yang deficiency than qi deficiency. So spleen and stomach. Li Zhongwan, again, this is like the tie-in syndrome. Li Zhongwan, again, we want to do moxa. Key signs and symptoms are going to be low energy, poor appetite, bloating and distension after eating. Loose stools with undigested food, watery stools, maybe worse in the morning, right? Weak pulse, pale tongue, sallow, pale complexion, feeling cold, feeling weak, right? These are all the main signs of qi and yang deficiency of the spleen and stomach mostly. Okay, if we have a stomach yin deficiency, a lack of stomach yin, we'll have thirst with desire to drink in small sips, red tongue without coating, okay, thin, rapid pulse. What are other main signs and symptoms? These are the empirical symptoms for stomach yin deficiency. We don't need to use any other, for acupuncture, we don't need to use any additional points. I mean, not, if we're just treating the nausea. For herbs, we would use a different formula. For food retention, okay, food stagnation, key signs and symptoms, acid regurgitation, right? Aggravation or onset worse related to eating food. Usually there's some kind of like, food poisoning or something of this nature. Adding a few points, there's often some blockage, so you may have bowel irregularity here. They're using stomach 25, Tian Shu here. Stomach 21, back shu of the stomach, but again, we're still using the same points as we were using for the rest of them, stomach 36, Ren 12, etc., etc. If there's borborygmus with it, so spleen, a little bit of spleen weakness. I'm not really sure. Borborygmus isn't a cause I'm not sure why that's here. It's not normally a cause of vomiting, but you know, Pishu, this is spleen deficiency, and again, using the large intestine, Da Chang Shu point to descend that. And if we have acid regurgitation and dry vomiting, then they're adding spleen 4, again, because of the Chong-Mai relationship. Okay, so how is that for fast? How is that for a summary? So these are the following slides, basically repeat, and again in the notes, it goes through what I said, but a little bit more detail. What is the etiology and pathogenesis? Essentially, anything that disrupts the descending function of the spleen. It could be strongly related to food and diet or some other accumulative factor in the stomach and spleen. Remember, whatever we take into the stomach is going to go directly there. If it is deficiency, so phlegm is one of the considerations, 6 pathogens, food stagnations, these are the major things. We also have, what I saw that's not listed here, stomach blood stasis, for example, is a common, if we have stomach blood stagnation, a stomach ulcer, we could have vomiting, and that would manifest with fixed severe stabbing pain, a choppy pulse, right? Maybe vomiting of blood, that's dark. That is another possible pattern. Okay, primary, secondary treatments, and then we can also, usually do auricular acupuncture, especially if it's a more chronic condition. This, add this in as a way of helping patients for the long term. If they can only come once a week or something like this is useful. But again, for the treatment plan, emphasizing if it's an acute condition, an exterior condition, or an excess condition, diagnosis is excess in nature, generally they come a little bit more frequently and for a shorter period of time before we reassess and reassess the case. Okay, so if somebody has food stagnation, for example, they should be improvement very quickly. After a few treatments and a week or so of the herbs, they should feel mostly better, right? But we don't just say only give them that and then don't come back. We have to give them that, make sure that they come back to reassess and make sure that their condition has in fact improved. If it's a deficient condition, it's chronic, we know that it's going to take more treatments, right? Twice a week, for example, moxibustion. They may have to take Li Zhongwan or Fuzi Li Zhongwan or something like this for a longer period of time before it creates a lasting effect. So we may have them come for 4 weeks before we reassess and then see how they're doing. Make sense? We didn't really talk about one thing to be mindful of, I suppose, is morning sickness. So morning sickness, of course, is nausea related to pregnancy, and you have to be careful of points and herbs that are contraindicated from pregnancy. So some of the points that we're using in if we use any of these points, or we have to be very careful with the points on the lower back, that may be contraindicated. Say again? What is? That's right. Yeah, so all the needles on the lower, especially the lower, the abdomen area, we can't do. So we have, if you, don't just write it out of the book. Oh, pregnancy. I'm going to do Ren 12, Ren 10, or because there's nausea, right, and vomiting. I'm going to do all these points. If there's pregnancy, you can't do that. Okay. your formula is just to kind of not sure. Okay, so they're okay. They don't write it down very clearly here, but for excess syndromes, for phlegm accumulation, we probably use urchin-tong. For liver qi stagnation, it's probably a chai hu shu gan san. You know, because it says jishi in it, it helps descend the middle jiao. It's a little bit, but we can also use shao chai hu tong because it has ban xia. So depending on the presentation. Si Qi Tang or Zhou Jin Pian. Okay. Spleen yang deficiency. Again, mostly I would use Li Zhongwan or a modified Li Zhongwan. Using Sha Ban Li Zhongwan, so it's again modified Li Zhongwan. Explanation of herbs here. So those of you that are learning and studying TCMP, it's good to understand why each herb is being used. Just moving through these. Stomach yin deficiency. Main formula is modified Mai Mendong Tang. Okay, and other prevention for mild, make sure you think about diet and eliminate any cause. You know, diet obviously is a consideration with nausea and vomiting. Severe vomiting, make sure there's not something else going on. You know, if it's severe vomiting, such as stomach ulcer, cancer, pregnancy, internal trauma, bleeding, things like this, all could cause it. I don't think that's too much of a concern here at this point for the PLAR case studies. You know, so for the purpose of vomiting, you know, this is more of a concern if the patient is in bed, if they're bedridden. It's just a major consideration for you as a healthcare practitioner. Let's say you're working in a hospital, a patient has nausea and vomiting. They should lie on their side always, because what if you leave the room and they vomit and they're lying on their back and they're bedridden, they choke on their own vomit. So, you know, again, it's not very common or likely in a TCM practice setting, but you know, if a patient has nausea and vomiting and you treat them for this on their back with acupuncture, you better not be too far away, because what if they feel sick and they get nauseous when you're not in the room? And then, you know, it's just a consideration. I mean, it's not very likely, but be mindful of that. You know, mind your diet. Remember that yeah, eating proper meal times and things like this. Okay, don't eat when you're stressed. Don't eat when you're upset and emotional. Okay, so for Chinese herbs, Chinese prescriptions, remember, if you're taking herbs, they often make people feel nauseous and they can make people vomit. So how do we adjust this? Well, maybe more frequently. So you take 1 cup, you drink half, you know, half in the morning, or 1/3 in the morning, 1/3 in the afternoon, 1/3 in the evening. Sometimes a little bit of food in the stomach actually makes it less easy to vomit. If you have first thing, sometimes it can induce vomiting. You know, if there's signs and symptoms of exterior patterns, so for example, severe headache, high fever, coma, blood, severe pain. No, so this says here, without stool and or wind from the bowels, it means that like no bowel movement. We need to be careful because in severe conditions of, for example, intestinal obstruction, let's say somebody has a herniation and the intestine pops out and we have full obstruction of the intestine. Or what if they have cancer and we have full obstruction? There's no bowel movement and the patient has pain and vomiting. It's a red flag. We need to be very careful of those conditions. That's what that's talking about. So that means that, you know, basically this is a whole list of like, these are red flag referral conditions. Know that if you see these, you need to refer them sometimes to the ER, sometimes to the family doctor, depending on what it is. If there's a lot of fluid loss in the body, so diarrhea and vomiting are both forms of kind of severe and acute loss of fluid, so make sure that if there's symptoms of dryness and somebody's vomiting a lot, that you get enough fluids in the body and nourishing the yin enough, okay? Okay, any questions on that? So far, so good? Is that, so let's, it's 1:12 right now. Let's take a break now, and we will, when we come back, we're going to go, we'll keep going through the internal medicine stuff. And then I'll save some time to do some practice cases at the end, okay? So when we come back, let's come back, you know, try to be back a few minutes before 2, right? It's about 1:12 right now. So just so that we can start right at 2, because if I say come back at 2, it means we don't start till 2:10. So come back at like 1:55 or something like that, and then we'll try and start right at 2. And yeah, okay. And now would be a good time. Anybody who's online that has issues or whatever can maybe work them out with Alex. Okay. All right. Okay. So we're back from lunch. It's 2:05. So just before we keep going forward into, this is the book that we'll be looking at in a minute, but before we go forward, this I was looking for this earlier at the beginning, the sample case study that they give us. So when we go into the actual practice cases, which we will do towards the end, okay, I sent you some case studies examples that we can talk about today, but when we actually practice doing them, we're going to do that at the end, towards the end, because they do take a lot of time, right? It takes a long time for you to fill out and write in all that information, a long time for us to discuss it. So we can only, you know, we can't do that many. But what's important is to see, so if you can't read the board right now, see if I can zoom in a little bit. Okay, so this document is online under, if you do I just did a Google search for CTCMPAO PLAR example case or sample case, you'll find this document, which is, the document is titled, it has all the other information about the PLAR exam on it and has a sample case. So it's Guide to Complete PLAR is what the document is called, a PLAR Guide version 0001. And within that, there's a sample case. And so, you know, this is really repeating some of the stuff that I started the course today talking about, where I said, okay, we'll pay attention to the medical history, the patient demographics, these things. they do sometimes give us important and useful information, family history, and then we see so this also reflects what I described as subjective versus objective. So what the patient describes their symptoms to be, and then what I observe, which will include tongue, pulse, facial complexion, movement, etc., etc. All right, it gives us most of what we have for most of the information that we have for the TCM diagnosis, and then and then we're given a blank response form. So talking about what should we expect to see in the PLAR exam? Well, I already said TCM diagnosis is both the illness and the syndrome differentiation, right? So the diagnosis is, like we talked about this morning, cough caused by phlegm heat in the lungs, for example, okay? But then they say reasons for diagnosis. So this is, again, why you then have to go back and explain, well, cough, the patient presents with cough, that is A, B, C, and D, repeating the signs and symptoms, which indicates phlegm heat, and this is confirmed by the objective symptoms of a red tongue with a yellow coating and a slippery, rapid pulse, right? The phlegm because it's slippery, the heat because it's rapid. I'm paraphrasing, obviously, but you have to be able to explain to me why you made that diagnosis, right? Then you have to write down the treatment principle, which is, okay, if your diagnosis, and this is also something that we can focus more on moving forward, some practitioners are they're not used to this, so they may write the diagnosis and then just write the treatment. They don't actually write the treatment principle. But if the diagnosis is cough caused by phlegm heat in the lung, what is your treatment principle? How do you write it? Clear the phlegm and reduce heat and stop cough. Those are the 3 key points. And the way that you phrased it, so you said clear phlegm, reduce heat, stop cough. I would give you credit for that, right? Yeah, because you're hitting the 3 key points that I'm looking for. Even though it's not standard, normally we would see transform phlegm, clear heat, stop cough. That's a more normal TCM phrasing, but doesn't matter to me. I'm not concerned. I'm concerned that you could identify all 3 of those. But if you just write clear heat, stop cough, that might lose a point. Make sense? And each section is worth, it's not just like right or wrong, it's worth some points. So if this is worth maybe 5 points, your treatment principle is worth 3 points or something, let's say, then maybe I only give you 2 out of 3. If you don't hit all 3 of those key points. Make sense? We may also, for example, like we talked about a condition where you have wind cold, but also, I'm just going to close this door for a second. You have wind cold, but you also have kidney deficiency. In the treatment principle, maybe you start with, I'm going to release wind cold from the exterior. Maybe I do or maybe I don't actually tonify the kidney. I would say I might indicate that treatment plan. First, release exterior wind cold. After the exterior pathogen is resolved, then I'll tonify kidney, right? So this is the place that you would want to write that. Treatment plan is what we are doing, which is the points. But remember, the other thing I'll emphasize, we just had a new person walk in, is that we would also include the plan. So, I'm going to do these points, cupping, whatever it is on these points, this many times per week for this many weeks or for this many treatments, and then reassess. So what is your treatment plan, right? So this is actual, it's not just what points you're using, it's, sure. Pathogenesis. Okay, so the question for those online is, in the section on diagnosis, do you need to also include pathogenesis? My answer would be, I would, if it's clear. So if you understand that clearly, why not? You have lots of time to write, so include it if you can, right? So, sometimes it's not entirely clear how somebody gets a kidney Qi deficiency. And I don't want for you to make assumptions that are not true based on what you see. But if you see something that's very clear, patient had wind cold, but now they have cough and fever, you can say that this is wind cold transforming to wind heat in the lungs or heat in the lungs. That's a pathogenesis that's describing the mechanism if it's clear. Yeah. Question. So a treatment principle is, it goes with diagnosis. So what's a diagnosis, right? Diagnosis, we said in this example, in my example, I said cough caused by phlegm heat in the lung. That's one of the patterns we talked about earlier. That's a diagnosis. The treatment principle is to transform phlegm, clear heat, stop cough, is what I'm doing. Basically is usually more or less opposite the diagnosis. The treatment itself is, I'm going to use this point, so, what do we say? So UB13, lung 7, Li4, Ren 17, whatever, the points that we're using for phlegm, heat, cough. And the treatment plan is I'm going to use these points. I'm going to treat the patient 2 times per week, or whatever it is, for 8 treatments, or for 4 weeks, let's say, if it's phlegm heat, and then I'm going to reassess. Okay, so they have the example here. You can kind of see that clearly. In their example, they're talking about the case that they give, which is very easy. So their case example is here. They gave all these signs and symptoms in their case example, and then their answer is, the illness is tinnitus. The syndrome is rising of liver and gallbladder fire. So it's a little interesting. What's the difference between rising of a liver and gallbladder fire as opposed to liver fire? Well, they're simply explaining the symptom of the tinnitus, which is rising. So, if we just say liver fire, that's the main pattern. They're just saying rising of liver fire is what's causing the tinnitus. And they're saying gallbladder because the meridian effect. If it's tinnitus, that's the main manifestation. It's not just in the liver channel because that doesn't connect to the ear, so it must be liver and gallbladder. Can you explain that in your diagnosis, in your case? Can you explain why they're using both? Okay, there's no way to just assume that you can look up something and write down the answer in this exam. You have to be able to think through it a little bit. So, and then they go on to explain their diagnosis. So the tinnitus seems due to anger, fear causing upward rebellion of wind, fire on the liver and gallbladder, and obstruction of qi in the Xiaoyang meridian. So they're expanding on their reasoning for saying gallbladder by Xiaoyang channel meeting at the ear. I might be a little bit more specific, and I might say, because the ear is the meeting of the Xiaoyang channels, and the liver and gallbladder channel are paired. Therefore, the excess condition of the liver, i.e., liver fire, is manifesting in the Xiaoyang channels, the gallbladder and Sanjiao channel in the ear. I don't know. I'm just giving you an example of how they worded it one way. I might word it a different way. You're going to word it in a different way, but it has to be succinct in explaining what the disease is and what's causing it. That's what they're looking. So think about it from a government perspective, from a regulatory perspective. I want to make sure that you as a practitioner, a healthcare provider, can explain to me, the public, why I have tinnitus, right? That's our scope of practice, a TCM diagnosis. Use TCM theory, meridian theory, Zhang-Fu theory, 5-organ theory, etc., to explain how my imbalance is causing my tinnitus. That's all we're doing. You do it every day. You just have to learn to write it in words. And that's, my experience. I've taught the PLAR course a number of times now. My experience is that most people that are doing PLAR are experienced. They know the material. A lot of them have a hard time putting it in words, right? So that's what we need to practice, okay? Then they go on to explain based on the signs and symptoms, red tongue, yellow coating, wiry rapid pulse. This all confirms or indicates the liver fire pattern. Their treatment principle, so this is, reason for diagnosis. Treatment principle is to clear heat and fire from the liver gallbladder, ease the ears, and calm the mind. Okay, I don't know what that means, for whatever it's worth. I'm sorry, I don't know what ease the ears means, but it obviously means to stop tinnitus. So the key point is, I might use a different phrase there. I've just never heard that in TCM terminology. I might say something like clear the Xiaoyang or something like that. I don't know. But, some of these Sanjiao points plus the local points that we would use for tinnitus are being explained by that. And then your treatment. So again, this is what I keep emphasizing because a lot of people just forget to do it. So they're saying treat 2 to 3 times a week for 2 to 4 weeks or until symptoms reduce. Okay, and then reassess. So I'm just reinforcing this. Get you in the habit of putting that in every possible treatment. When you're working with patients, you want to be doing this. Okay, I'm performing diagnosis on you, my patient. Okay, even though we can't use the term doctor, patients think like that. Okay, practitioner. Okay, doctor, right? Okay, practitioner. How many times do I come to you, right? How long is it going to take for my condition to get better? You have to be able to answer that question. This is a way of doing that. Now getting in the habit as an acupuncturist of saying, of saying, okay, you have tinnitus. Okay, well, in your case, tinnitus is caused by this, and I would like you to come this frequently for this number of treatments, and then